Good morning. Welcome to Village in Motion. Today is Tuesday, the 12th of April, and we welcome you. My name is Susan Gerhard. This morning we're going to be talking first with representatives from our medical center, and we have Dr. Sonia Bethel here with us.
Hello.
Tell us what we're going to talk about today, Sonia.
Okay. Well, we are just giving you a little update about, what's happening in the medical center. And I will say that we have welcomed a new practice administrator. For most people, you think of that as an office manager, but it's called practice administrator. Her name is Jemima Dunchi. And if you have not had an opportunity to meet with her or chat with her, I would, recommend that you do that and welcome her. It's been a couple of months now, but it still takes a while to...
Still getting your feet wet.
Yes,
to
exactly.
meet all of us.
That's exactly right. And then we're also very firmly entrenched in chronic care management. So if you haven't heard that term, you might know it as CCM. And when you're in the medical center, ask your providers about it if you haven't been asked.
Chronic, can you give us just a quick teaser? What is chronic care management?
Well, it's a Medicare sanctioned program whereby Medicare recipients consent to having a primary care office, and in our case would be us, to manage all of your care among specialists, among radiological facilities, among other disciplines here on campus. And so once you sign the consent, you get a visit where you establish a plan of care, and then beyond that, monthly, you get updates, you get phone calls, you get communication from the medical center, and it helps you to reach goals that relate to at least one or two chronic medical problems.
So this would be an existing condition that is chronic for that person.
Exactly.
But really a team of people helping you work through that.
That's exactly right.
Excellent. Sounds like a great idea, especially if Medicare pays for it.
Exactly right.
That's
good.
It's,
all of the Erickson campuses are, are involved in that, and we encourage you just to ask us and to participate.
Excellent. Thank you.
Yes. And we also have with us Dr. Mildred Sartee-Pra, and she is our podiatrist. She's been with us now for
close to 6 years.
Okay. She's in her 6th year.
Welcome.
Thank you.
She's going to talk to us about foot care and preventing problems with your feet.
Okay. An excellent topic. So go ahead, Dr. Sartee.
Oh, thank you. So basically this morning I just want to emphasize some tips and pearls with podiatry and foot care, specifically our diabetic patients. We find that with diabetics there are a lot of foot problems, and you may ask, why is it that with diabetics we have a lot of foot problems? And that's because of the high blood sugar. With high blood sugar, they are pre-exposed to a lot of conditions, such as high blood sugar would cause damage to the nerve, which is known as neuropathy. And as a result of neuropathy, you can have loss of sensation to the feet. A diabetic patient may not be able to feel cold, heat, or sometimes pain. And then there's a reverse of that where they may have exaggerated pain, where you have tingling, where you have throbbing, where you have aching. So that's one reason why you may have foot problems in diabetics. Another reason is high blood sugar also causes the arteries to harden and narrow, and this can restrict blood supplies to the rest of the bodies, the foot and the hands included. So I just want to talk about tips of do's and don'ts.
Please.
These are simple things that can save and prevent our patient from foot problems. Number one is that we want you to inspect your feet on a daily basis, and we also want you to take care of your feet. We want you to wash your feet. However, don't wash your feet with hot water. Use warm water.
Why is that?
Because hot water can cause blister. It can also cause thinning of the skin. Skin is usually fragile in diabetic patients, and when you have a fragile skin, you're using hot water. That could cause skin breakdown.
So the advice you're giving us is focusing on those who are diabetic, but also good advice for all of the rest of us.
Exactly. In the elderly, that is good advice as well, because as you know, with maturity and with elderly care, we do have thinning of the skin as well. So your skin is fragile as well. And another thing is you don't want, in a diabetic patient and also in our patients in general, I tell my patient, don't soak your feet, don't scrub your feet, just because of that factor. You rub in the skin, that's trauma to the skin. Another thing is that diabetics have corns, calluses, warts sometimes.
More so than the rest of the population?
Yes, ma'am. Okay. And with the elderly community, and in our population, I'll say our community, I often advise don't use over-the-counter medications. Don't use any harsh antiseptic solutions that will cause your skin to scar or rupture.
So I'm thinking of all the things we see on TV, that this will make your feet beautiful. You can shave stuff off, you can rub stuff off. You're telling us we should stay away from that kind of thing.
Stay away from those things. Scissors, shaving, it's a no-no. If you have any questions about those things, come and ask me at the medical center.
Okay.
So to go further, I also want to advise that when you inspect your feet, things to look for. Look for cuts. Look for scratches, look for redness, look for any swelling, look in between your toes for any maceration, okay? When you speak about maceration, it's cuts in between your toes. The most common thing that I see with maceration is that most of our patients, they mean well in the fact that they want to moisturize their feet because at times our feet get dry, but the mistake that is made is that we put cream in between the toes.
So we should, it's good to moisturize our feet, but not between the toes.
Not in between the toes.
Interesting.
That may cause fungal infection and laceration and maceration, like I said. So stay away from that. It's fine to just dab in between your feet dry.
Help me understand. I don't know what the word maceration means.
Maceration is basically cut in between your toes when you have sores.
And a laceration?
It's a cut as well. Maceration is as a result of a rubbing.
Okay.
Laceration may be as a result of an object or a rubbing that just opens up. It's a little bit deeper.
Okay. Scary stuff.
Yes, ma'am. Not too scary if you have the proper foot care.
Talk to us about what we should put on our feet in the way of foot covering, shoes and socks that will help our feet stay healthy.
Thank you. I'm glad you mentioned that. You want to wear comfortable shoes, shoes that you can wiggle your toes in. You can wiggle your toes in the shoes. You don't want to wear tight shoes. You don't want to wear flip-flops. You don't want to wear pointy shoes, and you don't want to wear high-heel shoes.
So toe wiggling is the key.
Toe wiggling is the key, and you also need a shoes to give you a sole that will protect and give you the balance that you need. You don't need high heels. Anything less than 5 centimeters is good. You have that base.
5 centimeters is
very small.
Okay.
1 to 2.5 inches.
Okay.
Nothing above that. So you need that base to have stability. Okay.
What about arch support? Is that important? I'm hearing my mother in my ears saying, oh, you need to have some support for your arches.
Yes, very important. And it's not even for diabetic patients, it's for our patients in general. As we mature, we need to have that balance, to have proper gait so you don't fall. So it's a level of the risk management of falling. So for orthotics, what you need is something for flat feet. If you have a flat foot, we will advise you to find an orthotics that will address flat feet. If you have a high arch, we advise you to find something that will address high arch. But you will know this if you don't come to the medical center and get evaluated to know what kind of foot type you have.
You could guess, but you wouldn't really know.
You wouldn't really know. And my patient would attest that I always tell them where to go, even if it's not custom. If it's prefabricated, which are the ones that are already made, then know the appropriate stores to go to get that.
So the real key for most of us with just everyday shoes is good support.
Yes, good support.
So that we feel stable when we're standing, we're not teetering on a heel, we're not falling over the edge of the shoe.
Exactly. And another thing that I wanted to stress with diabetic foot care and foot care in general is this season, I mentioned no flip-flops.
Yeah, I wondered about that.
Absolutely no flip-flops. They do have, because I have patients who actually injure themselves from flip-flops. So stay away. Have sandals that have great base. Okay. Also, as the summer is approaching, I've been here for close to 6 years, and in the last quarter of last year and the first quarter of this year, which is about 6 months in between, I've seen too many cases of foot-infected wounds where a patient may have a cut or a scratch and decided to stay at home and take care of it. And by the time they saw me within the period of 2 weeks, we were admitting them to Fairfax Hospital for IV antibiotics.
That is just really scary and great advice.
So that's one thing I want to stress. If you have a cut, if you have a scratch, 24 to 48 hours is the most, and that's too long. If you're still feeling pain, if it looks red, if it looks swollen, even if it doesn't look red and it's not swollen but it's open, come to the medical center, because that could prevent a serious infection. And remember that even though diabetics have neuropathy and also arterial insufficiency, that also applies to our entire community. We are in a community of the elderly, so you may have a neuropathic foot and don't even know it.
So I guess the bottom line is that if I have a question about my feet, I need to come and tell you.
Exactly. If you have concerns, if you have any questions, no questions are stupid questions, come to the medical center, make an appointment, and let's chat about your feet.
That's good. I think, our feet are way down there. We don't think about them much, but they carry us. We have to keep them healthy. If you wanted to give us one overall bit of advice about our feet, what would it be?
That would be take care of your feet, and you can start with a foot examination and evaluation with the podiatrist. I love talking about feet.
You love talking about feet. Well, we're glad you're here.
Thank you, ma'am.
Yeah. Dr. Bethel, we have just a little over a minute left. What else would you like to share with us today?
Well, I would just like to say that if anyone has not been contacted about establishing a care plan visit for CCM, please contact us, and we'll be happy to take care of you. And just know that our same-day appointments are always available. So if you wake up in the morning and decide, oh, I'm really feeling bad and I need someone to evaluate, my conditions, you can call, and we'll get you in to be evaluated.
I know that has happened to me and to many people that I know, and we're so lucky to have your team here on campus to take good care of us, which you do a wonderful job of.
Well, thank you.
Yeah. Well, I thank both of you for joining us today on Village in Motion, and we'll look forward to seeing you again soon.